Welcome to the Fertility Matters podcast, brought to you by ReproMed. I'm Rebecca Horan, your host for this podcast, and today I'm very happy to be joined by Karen McNabola, who is the Senior Fertility Midwife with ReproMed, and Marta Boraganli, who is the Onboarding Executive. Welcome, ladies. I'm very glad to be speaking to you because this is an area of fertility that I probably wouldn't know that much about. So Marta, I'm going to start with yourself.
Sure.
A really key component in this entire process, a really important point of contact, is the onboarding executive or the client onboarding executive. Tell us what on earth that means for anybody who is starting on the fertility journey or who would really like to reach out to ReproMed and perhaps has looked at the website and gone, I don't know what to do. Tell us what your role involves.
Yeah, absolutely. So basically, I'm part of the onboarding team at ReproMed. And basically, we're the first point of contact for all patients. Anyone that, sees our number on Google and gives us a call, I'm on the new patients line with the team. And we basically tell patients just how they can get appointments, kind of provide that first point of care, provide empathy. It takes a lot of courage to fill out the forms and be involved in the process. So basically, we just kind of guide them to how to get that appointment with our fertility consultants. So basically, they can go on our website at repromed.ie. There's a big make an appointment button on the top right-hand corner of the screen. You can't miss it.
Simple, okay.
Yeah. And you basically click on that and it redirects you to 3 different forms. So it's one's for female and male. So that's heterosexual couples. Mm-hmm. And then we have the female, same-sex couples, and then single females. So then the patient just picks the one that applies to them, fills out the form. There's just some medical information questions, such as, how long they've been trying to conceive, just as much information as they can give, just so that the doctor is prepared and can really kind of provide the right kind of care and personalized treatment plan for them.
So this is quite vital because you're gathering all of this information up for the midwives and consultants so that they're really keyed into what, who they're going to meet, what patient, what kind of patient, so that it's not a, gray area when they come in.
Yeah,
so this is really important information that you're gathering.
Yeah, absolutely. Like some patients, it's their first time ever coming to a fertility clinic. So, they won't add as much information, but sometimes, patients do come after rounds of different cycles that they had done elsewhere. So it does take a lot of courage, to bring up these kind of memories of failed cycles. So but, we really try to just encourage them to just add as much information as they can, just so that the doctor is much prepared for the consultation. So, yeah.
Absolutely. It means that they have everything and they're geared up and ready to go. But there's a lot of caregiving, hand-holding, warmth involved in that. Like you were saying, empathy, making sure that they really feel like this is okay, because it's such a sensitive topic. I mean, I was saying that earlier, like this is not that easy for everyone to talk about. Some people will fly in and they've really made a decision in their adult lives that they would like to have a child on their own or start a family. And some people have really been through to hell and back. So Karen, coming to you on this, at this point, do you and Marta work quite closely together? Obviously with these forms being filled out, you would have to look through all of this detail to see what has gone right or what has gone wrong, so to speak, or if they've been referred by a family GP or a consultant. So you really need all of this key information also for the process.
Martha's job is really important because she gathers all that information for us and for the doctor as well. Okay, so once we have all that information, then she'll also book the appointment then to have a consultation with the doctor. Doctor will have an individualised treatment plan then drafted up after the conversation with the couple or with the individual if you have someone that's single coming through for treatment as well. So once that's all kind of completed, they've had the discussion then, we just start the treatment process then.
Okay. So it sounds really simple. It's like, we just start the treatment. But, I suppose you're having to then, Marta, fill them in on what's going to happen. So I presume you have to, do you send them information? Do you have Zoom calls? How do you make sure that they know what they're getting into?
Yeah, sure. So once the patient fills out the form, we receive the form and then we give the patient a call and we kind of explain to them the whole process. Okay. So if they haven't had fertility tests done before, we provide these fertility tests previous to the consultation. So for the female side, it would be an AMH blood test or an anti-Mullerian hormone test. Essentially what that's checking for is just the amount of eggs a female patient has relative to their age takes a closer look at the ovarian reserve. And then for the male side, it would just be the semen analysis. So he would produce the sample at home in a sterile container.
Okay, so you wouldn't have to come in.
Yeah,
okay.
Yeah, so he produces it at home just due to COVID at the moment in a sterile container. This can be found, in any pharmacy. It's the same one that you would use for a urine sample cup, just as long as it's sterile, and then just bring it into the clinic for analysis. So we can organize that, both the female and male come in at the same time, get their test done. Then a few days after, we would just book the initial consultation, which is happening just online via Zoom video call. We leave the Zooms for an hour in the diary just so that there's a lot of information given. The patient can ask as many questions as they like, and the doctor really can go over their results, what they mean, and what kind of treatment plan they advised. Sometimes they'll know the treatment plan from then. Perhaps otherwise they'll need further investigations, like extra scans or blood tests, which the doctor will also disclose during that time.
But a really essential role, it's funny, onboarding executive, and you think of it as quite like a corporate role, but in this case, it's a really important role because this is the touch point for whenever they're like, look, I didn't know why that, and I want to find this out, and actually then I have this, and even changing things around, so vital. But then it comes to getting these tests done, okay? Mm-hmm. And I presume you've gathered the results. Mm-hmm. You're then bringing them in or having online consultations to let them know the results. So not always fabulously positive, I presume. And how do you go about relaying this information, and what then are the next steps?
The doctor will go through all the results with them. So whether it be like what Marta said, the AMH or the scan results, the doctor will discuss everything individualised. And that's where the treatment plan is tailored to the couple and to the individual as well, okay? So the treatment plan is drafted, they're given all their information, we always have them take a step back, take all the information in, because sometimes when a doctor goes through everything with you, you'll have loads of questions down the line as well. So what we'll do then is they'll come back to us, they'll say, okay, yes, we're ready to proceed with treatment. So we will give them a kind of a time frame in terms of their cycle dates. So we'll need to know cycles in order to start medications at a particular time in their cycle. Okay. So we'll book them in, get them planned, and then we'll also arrange to have a nurse consultation. So we do nurse consultations via Zoom at the moment, just the way with the pandemic is at the minute. So it's a good opportunity. So it's a half an hour Zoom consult with a nurse. She goes through all the treatment plan, all the medications, timelines, anything the couple may have any questions about.
Yeah, because this is, before the pandemic, and it will go back to normal, hopefully. You're getting to sit down face to face with your nurse or your doctor, and like, oh, I have to inject, or I have to take this, or I have to, and how does that, so it can seem really overwhelming. So to get that time, proper time with somebody is really important, because it can seem very overwhelming, and sometimes all on the woman or perhaps all on the man. Yeah. And it's just to break it down for them, because I think some people can be quite put off by the amount of hormones they might have to take, or injecting at all, or prescription. And it's just to simplify that, I presume. Yeah. Are people quite nervous usually?
Of course.
Yeah.
And I'd be surprised if people were nervous, to be honest with you. So you would expect it. Yeah. Pre-pandemic, we would meet, you'd have an opportunity to meet couples face to face, and it's a touch point for them, because you're going through a process with them, and you get to know them, they get to know us on a first name basis, and even though I know we've got all the masks, they still, they get to know us very, very well. Yeah. So the best thing that we've kind of made of the situation, the pandemic, is the Zooms, which is a really good touch point. And you have that opportunity to have even a good kind of chat about everything, and we realise that this is something that's going to be brand new. They're not expected to know everything, and that's where we're here. So we go through the whole process with them. Do you know what I mean?
So the process starts, and Marta, at that point, do you step back a bit until there's an outcome or something happens at the end, and you're starting then on another patient? Is it that simple, or are you with them the whole way through?
So we basically kind of send them off after, they
let
meet
them
with
fly.
the doctor.
Yeah.
So we send them off after. So basically my part of the journey is just the very beginning, kind of giving as much information as we can to new patients, taking them through those initial steps, booking them in with the consultants, answering all their questions until they meet with the consultant. And then once they meet with the consultant, we kind of send them off. But I mean, it's always lovely to hear about the outcomes. We see the patients that we've booked in, and, with their positive pregnancies and their births. So it's amazing. It's really nice.
Marta, you would know this because you're really dealing with such, I suppose, a myriad of different cases at the moment, with fertility being where it's at in Ireland. And I think we're probably getting there, but we were so way behind for so many years, and it wasn't, you really couldn't, if you were told, you're infertile or you're not able to conceive at this point, that was kind of the end game. And it's so fantastic now that there's this options. So you will see so many different cases. Are you seeing more and more same-sex couples, women coming in perhaps on their own who want to start a family, men coming in? Are you seeing a lot more of that, or is it really not as, is it still quite a small amount of cases?
Yeah, so I mean, naturally the most popular would be male and female, so heterosexual couples. But yeah, I mean, there are a lot of single women coming through for either egg freezing or, treatment with donor sperm, whether that be IUI or IVF with donor sperm.
And you facilitate that as well?
Yeah,
and
absolutely.
ReproMed. Okay, wow.
Absolutely, yeah. So we work with 2 donor sperm banks.
So it's not just a one way, a couple's coming in, they're married and they'd like to start a family. There's so many different variables,
Yeah, absolutely.
Okay, that's interesting.
So yeah, single females coming to use donor sperm, same-sex couples as well using donor sperm. And even egg donation as well. So
if you're saying a single female's coming in and she wants to do this, she's investing her time in this, and you're saying donor sperm, that's nothing to do with ReproMed. That is something that she has researched prior to coming to you, I presume.
We'll help her along the process.
Okay, fine. Okay, so there's a little, if someone's like, I really want to do this, I have no idea where I reach out or where I'd find a clinic. Okay.
And we found recently, even with the pandemic, there's more and more single women who are coming in who in the pandemic were not meeting people face to face on nights out, or so we there's people who don't have partners, so they're like, they're going to take everything into their own hands. So some people will decide, we've seen it more in the last kind of year, to actually decide to egg freezing. Okay. And if they don't want to do egg freezing, they want to start their family themselves, they'll come in and they will start the IUI process too. Karen,
tell us what a game changer egg freezing is, because we talk about it and we read about it and it all sounds very out there, like something in Sex and the City, or I froze my eggs and because I'm a career woman. But tell us really the importance of that if you're someone who isn't ready right now at this point.
Well, the younger that you are, the younger, because as we age, our eggs will naturally age as well. Okay, if eggs do age, then their quality declines, and that's just a natural process in aging.
And what age do they start declining? Without kind of scaremongering, or what age do they start to kind of decrease?
Generally, most doctors will say any time from the age of 35 or thereafter that. So if you're somebody that's young, if there's somebody, maybe you're career focused and you just want to kind of, you maybe want a family in the future, or even if you're not sure, you could have your insurance policy to a certain extent. So what you could decide to do is come in for a consultation, do your checks like what Marta has said, get your AMH checked. We can do some scans as well. So the scans basically look at your ovaries and your antral follicle counts. So this is an indication of ovarian reserve as well. So they take 2 things into board, and they'll be able to tell you, at the moment, is your ovarian reserve normal? If it is, you might think about it, I'll come back in a year and I'll decide. If it's low, they might decide, okay, maybe I might, start this sooner rather than later. Okay, so what we'll do is we'll give them the information in terms of the egg process, the treatment plan, the protocols, and then a lot of people that will go for it, then they will have their nurse consultation and we'll discuss it with them how to start the process.
Would you not encourage necessarily, but urge women to be a little bit more proactive about their fertility, right, from a younger age? And I think it's something, I was even saying that it's just a given. We're all just going to have babies, but we're going to do it whenever, and it's not a big deal. And like, our parents had 20,000 kids and it's fine. And now we're starting to realise that's not often the case. And it's a really complicated thing, fertility, that it's not always just the same for everyone. Some people have textbook, they have 3 children within 5 years, or they have, and some people really don't have that journey, and it's much more difficult, be it for the male or female in a relationship, or whether you're going it alone. So do you think there needs to be a little bit more of a education piece when we're younger on checking your fertility, finding out what's happening there, and also knowing what you can do about it if for whatever reason there's family history or issues there?
I think massively education is an important thing. I actually talk about this with patients so often as well. When we're in school, we're talking about sexual health education, we're taught about STDs and contraception, but no one
putting a condom on a banana, really important.
But it is,
absolutely. But we miss those other pieces.
No one talks about fertility, and I think go back 20 years ago.
Why do you think that is? Is it just kind of awkward, or just not?
I think it's a lack of knowledge. I think it's a lack of education. If you go back 20 years ago, you wouldn't have heard much about, because it is a relatively new area as well. When you talk about egg freeze and IVF, these are, these are not things that you would have been known that were possible years ago.
Sure, but you're talking about preventing getting pregnant, which is something we're always like, be careful. And we, sex education is so important, but, and, also getting tested for diseases and all of these things. but we're never really told that actually, and people were always having pregnancy losses. This isn't just a new phenomenon, but we just weren't talking about it. Yeah. So it's a pity that it's also not touched on, because then I think when people hit their late 20s or 30s and they have pregnancy losses, they're so confused and shocked,
you know. And you meet women even during scans, and you have the conversations that even if they're going through the egg freezing process, there's a lot of times I ask people, what made you want to do this process? So some people will say the pandemic, it just made them reflect on things a little bit. Some people just, they thought about egg freezing either chatting to their friends, word of mouth, social media. So it's not something that's in an education curriculum that people talk about these things. Yeah. So it is simply to be, it is the case, it's a word of mouth situation. And, there's a lot of people that are delighted this is something that we can do. Yeah. And if you are career focused, or even if it's not even career focused, if you just want...
Aren't ready?
Yeah, if you just aren't ready, you want to take pressure off, that this is an option for you. This is something that wasn't in our parents or our grandparents' era. So this is something fantastic that we can use, in this time.
And maybe the next generations will be better informed. And I mean, things are always going to change with science anyway. It's always going to be bigger and better. It's going to be incredible, but won't it be great to know that there'll be no fear of why pregnancy loss, and no blame and no guilt and no shame, which I think is a huge issue. And it's his fault, it's my fault, oh gosh, I didn't realise I'm 37 and I was doing so well. I'm quite happy actually in my life, but now I kind of really would like to start a family, and that sadness then when you can't. So all of this we're hoping will make it easier, because I just think it's still a really tricky area. And I was also going to say, Marta, is there ever a time where ReproMed really can't help you? Would there ever be a case where they go so far and they touch base with you, but actually that's the end of the road, and is that quite difficult?
I always say when people, and Marta, you'll very much notice this, when people even make that first touch point with Marta, they've already been on a journey before starting their journey in ReproMed. So whether it be that maybe couples might be trying for a year or two, and then they decide to take matter into their own hands and just do some investigations, or as Marta said already, they may have had several treatments elsewhere and they decided to go somewhere else and see if there's something different.
So you would never say at that point, look, you've done this for a few years, I don't think we can help you. You're always encouraging, come in, there's always an answer. Okay.
Yeah, absolutely. We just encourage them to give as much information on the form so that the doctor can be prepared and really kind of investigate. If they've done, previous treatment cycles, we always ask for their treatment summary so that the doctor will review everything that they send in to us prior to their consultations, so that they're really prepared. It's not kind of a way that they're reading the results right in front of them. They're already prepared. They're ready to meet the patient previous to. So
I remember hearing a fertility expert in America recently who said absolutely anybody can have a baby, right? Now, quite a massive, statement, and also quite a broad statement, because obviously it's not necessarily through perhaps natural conception, but everybody can have a baby if they want to nowadays. Whereas I think the case was maybe 20, 30 years ago, if you can't do it this way, you can't do it. This is the end game. So when he said that, I remember just being like, what? But it's true. There's so many options nowadays. And I presume you do have so many different roads that you're traveling on.
So many roads, and sometimes the road to be honest is never straightforward. And I think that's one thing that when people are starting on this journey, that they're not expected to know everything. It's very much a step-by-step process, because if you take it all in one go, it can be very overwhelming. So a lot of the times, and even when I'm chatting and touch base with people, even over the Zoom consults, they're looking at these big bag of medications they're collecting from the pharmacy, and they're like, oh my god, what am I getting myself in for here? But it's very much you plan, and you have us to guide you,
but also focusing on that end game. This is all going to lead to something positive, hopefully, and
that it takes time. So a majority of people, if you're doing egg freezing, if you're doing IVF or ICSI treatments, you're generally on medications and injections for about 2 weeks before you'd have an egg retrieval. After an egg retrieval, then you would create embryos, and then you would wait until 5 days later to have an embryo transfer. And after the embryo transfer, you have a 2 week wait to even see if you have the
It still seems
test.
quite quick though. It's, you're not saying 2 years. You're saying that this can all happen within a cycle or within another, and that not to give up, and that we want to help you get there. And for some it's fantastic, and some it might take longer. And it's just not as simple for everyone.
And there's different treatment plans and protocols. So sometimes you will have one protocol and treatment plan that might suit one person, could be completely different for another couple or another person as well. So,
and what's the ICSI one actually you just mentioned there?
So ICSI is a form of IVF.
Okay.
So IVF basically entails where we would take some eggs and the sperm and we would fertilise them in the lab. So we'd have the eggs in a petri dish with the sperm, and the sperm would allow to naturally fertilise the egg. ICSI is used if there is any issues with the semen sample. So what they can do is pick up a good quality sperm and directly inject it into the egg.
Okay, so
it's
to give it that help.
Yeah, it's another extra method of fertilisation.
This is such a simplistic perspective, but you're saying, you're putting the sperm, why for some reasons can, it not happen? Like, why for some reasons can the sperm not travel and the egg not meet it? Like, why does that happen for some people? And without there being any like blame or shame, is it to do with fallopian tubes perhaps being blocked? Is it again to do with age? Is it just to do with just sometimes it doesn't, like, why is that process that you think should be so simple and natural doesn't always work?
There's various factors. If you look on the female side of things, for example, as you were talking about fallopian tubes, if the tubes are blocked, or if you had a tube removed from an ectopic pregnancy, for example, the sperm physically cannot meet the egg. So therefore what we do is we're like, okay, we don't need the tube, we can actually bypass that in the lab. So what we can do is stimulate the ovaries, collect the eggs, collect the sperm, let that happen in the lab, and then once we create the embryos, transfer it directly back to the uterus. So that's one example. The other example is on the male factor side. If there is any kind of, if there's, let's say in semen analysis, if there's a parameter that's an issue, maybe there might be a low count, the sperm just might not be reaching the egg, so that can be another factor too. Or sometimes morphological issues, so sometimes some sperm might not look very good. So what they'll do is they will use the ICSI as a way around that as well. So they'll pick up one single good quality sperm that's moving forward, that looks really good, and they collect the eggs and they'll allow that to happen in the lab.
It's actually incredible. I had a tube removed because I had an ectopic pregnancy, and I had no clue what fallopian tubes, honestly, no clue. In my 30s, didn't know what they were used for. Are they necessary? They just look funny. What are they hanging out there for? And it's only really, and you should think, an educated woman or anybody should know what's going on physiologically with your own body month to month or cycle, and you don't. And I was really so shocked to think that these were so vital to, I suppose, bringing everything to meet everything. And when it was taken out, kind of the shock of knowing it's going to be a harder road. So again, something maybe just to inform ourselves, maybe something, if you think that they're blocked or you think that there could be help, because I know that there can be help with that, can't there, to unblock tubes?
Well, it would
depend.
Not that simple? It's not simple. Tubes are very delicate structures, so if it's a case they're blocked now, it will be very much individualized, from patient to patient. But a lot of the times, if they're blocked, they could possibly be quite often damaged. So sometimes the route around that would probably be IVF.
Okay.
But again, just depends. And even as you said years ago, let's say 30-40 years ago, if somebody had an ectopic pregnancy and had 1 or 2 tubes removed, that was the end of the road, in terms of natural fertilization. Whereas nowadays we have, the scientific advancements.
I mean, I remember just not being told at all it was an end game. I remember being told you will have a child, but it's going to maybe take longer. What an incredible thing to tell a woman, to already empower them that you sit tight. It's not going to be something that happens quickly, but it will. And I think that's so wonderful and positive. I presume you both kind of feel sometimes like you act like counsellor when there's emotions involved and stress, and maybe for men too in the partnership, if it's not a man doing it on their own, maybe for men too. But I think for women in particular, there's hormones, and we forget how important they are. It can be so exhausting sometimes to go through a process like that. Do you feel like you're acting as a bit of a counsellor sometimes?
Absolutely.
Yeah, definitely. I even say in the beginning, patients tell us their experience, what they've gone through, how long they've been trying, they think something's wrong with them. It's really sad to hear this kind of perspective, but fertility has to do with both sides. It's never like the female is infertile or the male is infertile. It's the couple, together. Because
that's hard on a relationship, it's always this like, we're going to get married, it's going to be beautiful, and we're going to have picture perfect, and that's hard because when you suddenly realize you have a hurdle and one of the most important things that you want to do, perhaps it can break that kind of relationship and the communication and all of that down. And I suppose it's about bringing a little bit bit of belief back and hope back.
And it is hard. And then, you know, there's so many couples I have conversations with where, you know, their friends are getting pregnant and have only been trying for a couple of months, and, you know, they find that hard as a couple. And sometimes there's a lot of people that don't disclose to their friends or family they're going through treatment, so, you know, they find that
Why
hard.
is that? Shame or privacy, or just
probably a combination? I think it's very individualized. You know, there is some people that will find that, you know, they just want to, you know, start the journey themselves and
get on the road, and also not tell everyone, because they're like, how did that go? And you want to really and
they just want to focus on themselves. I think that's an important thing.
But then it is also wonderful when you hear people saying, look, I'm heading into this IVF land, or I'm heading into this having a baby on my own, which I've heard of so many more women doing, or a same-sex couple heading down this road that perhaps isn't adoption or surrogacy, it's this way. And I think it's just really encouraging. And I think the more people, I'm not saying everyone has to talk about it, some people really don't want to, but the more that talk about it, the more it becomes just normalised and less taboo and scary. So we can talk about all the science behind all of this and the work that has to be done to get there. But my God, it's really a story of hope and empowerment, and it's really exciting.
Yeah, no, it really is, because you're already on a journey with the patients already, and then once they have their embryo transfer, the IUI procedures, they'll come in to us 2 weeks later for a beta-HCG, which is the pregnancy hormone. So we do that via blood test, and we ring them with the results. So if it's a positive, it's great to, you know,
it must be the nicest. You're like, I'll take that call. That must be incredible. And what are the reactions? Often a lot of emotion,
relief, you know, happy tears.
It's trepidation still.
Sometimes they're just racing to get off the phone to tell their partners the good news. So, you know, there can be that element to it as well. So generally after the blood test then, we would usually schedule them in for a pregnancy scan at usually that point. So usually around 7 weeks gestation we'll be able to detect a heartbeat. So we'll bring them back in for a pregnancy scan, and once everything looks okay and we have a happy, healthy heartbeat, then we just start them to maternity care.
And you know what, it isn't always that simple. It isn't always perhaps the best news to begin with, but we always know that we can come back and try again and get advice. And it's not this scary thing that I think in the 80s and 90s you'd read about. Fertility was really out there and for the rich and for the famous or for the people who want. It's really such an open conversation now. It's accessible to more people. And ReproMed is making that a lot easier, I think, which is just great.
And I think it's just getting the word out as well that, you know, these are options, and it's even just kind of starting the conversation that people start talking about fertility. Like as we touched on, there's a lot of people who, you know, think it's taboo or don't want to talk about it or want to be a bit private about it, and that's totally fine. But I think it's just getting people thinking about these things, and, you know, go for your consultation, have your chat with the doctor, because information is power. So if you get all the information, you make your informed decision for you, what's best for you.
But also making everything less weird, and nobody, even the person down the road who's popped 6 kids out, nobody is having an easy ride of it with fertility or with anything. Not everything is as simple as it seems. And like you said, it's very hard when you hear of your best friends or your sister or your brother having babies and you're like, we're still trying. And that can you sometimes have to separate yourself from that journey and go, this is our road. Exactly. And by God, when we get there, it'll be all the more worth it. And I think that is something to kind of make sure that people, like an affirmation. And I remember I always had to tell myself that I will be so grateful. And you know what? And if it doesn't work out, this is a different path for me. Gosh, it's such a pleasure to speak to you both. Marta, thank you so much.
Thank you so
Karen,
much.
And keep up the good work.
Thank you so much.
Thank you for joining the podcast.
Thank you.